Good afternoon, and welcome to the White House. My name is Tina Chen. I am the Executive Director of the White House Council on Women and Girls. And on behalf of the White House Council on Women and Girls, I am delighted to welcome you here, not just to the White House, but in particular to the Jacqueline Kennedy Garden, where we are holding this event this today. As you all know, October is Breast Cancer Awareness Month, and we are very honored to observe it here today at the White House. You can see we've got our pink ribbons on here on our lapels. We have pink ribbons on our colonnade, and I'll give you a hint. Take a look at the North Portico tomorrow of the White House, and keep your eye out for more pink. We're especially pleased to welcome here breast cancer survivors and those whose fight with breast cancer still continues, who have joined us here today. And we have physicians and researchers who have dedicated their careers to battling this disease and searching for a cure. And we also have the leadership of some of the really important groups who are doing the work, leading the battle against this disease around the country. I'd also like to acknowledge the members of Congress who are here with us today. We have Senator Amy Klobuchar. We have Congresswoman Lois Capps, Congresswoman Kathy Castor, Congresswoman Donna Christensen, Congresswoman Rosa DeLauro, Congressman Bob Etheridge, Congresswoman Nina Lowey, Congressman Steve Israel, Congresswoman Carolyn McCarthy, Congresswoman Sue Myrick, Congressman Gerald Nadler, Congressman Peter Roskam, is he here? He was scheduled to come. And then finally, in particular, I want to recognize Congresswoman Debbie Wasserman Schultz. She's here with her 3 children. Congresswoman Wasserman Schultz is really someone who's taken her own personal battle with this disease. She's used it to raise awareness and improve access to treatment for thousands of women across the country. And she was an inspiration to us and an inspiration for this event today. So thank you very much. And I'd also like to recognize the leaders of 2 organizations that have been at the forefront in raising support and awareness to attack breast cancer. First, we have Fran Visco, president of the National Breast Cancer Coalition. Fran. And Jenny Lurie, who is president of the Susan G. Komen for the Cure Advocacy Alliance. They were both very instrumental in helping us put this event together, and we thank you both for all of your help and all you do for women every day. So breast cancer touches the lives of men and women from all walks of life. By the end of this year, nearly 200,000 new cases of invasive breast cancer will be diagnosed, and 40,000 people will die. Nearly all of us have been touched personally, either ourselves or someone close to us. For me, it's my aunt Dorothy Yang, who was Grandma Dorothy to my children, and she suffered breast cancer, diagnosed at the age of 75. So we're here today to join with NBCC and Komen and the many other groups that are here with us to call attention to the need to fight this disease during Breast Cancer Awareness Month and to stress the need for early detection and prevention. But we're also here today to underscore the urgent need for health insurance reform. Because those who are, thank you. Those who are stricken with breast cancer know all too well how broken our current health insurance system is. Because when you have breast cancer, it can mean you're denied coverage because you have a pre-existing condition as a survivor. It means if you can get coverage, you're paying thousands of dollars just to try to get that coverage. And if you can't have coverage, you're paying extraordinary sums of money out of your own pocket to pay for the care that you need. So today we're going to hear from some extraordinary women. We include first Dr. Jill Biden, and she'll be followed by 3 courageous women who've traveled from across the country to share their personal stories with all of you and with the country. And I will note that we are web streaming this live on whitehouse.gov, so anybody who's Twittering, if you want to get that word out, you can do that now. And then we'll have, in conclusion, the First Lady of the United States. So to start us off, it's really my distinct honor and privilege to introduce someone who's been an educator, a leader. She's been an outspoken and tireless advocate against breast cancer. She took action herself by founding the Biden Breast Health Initiative over a decade ago, which has educated thousands of young women about breast cancer and early detection. And she's continued at leadership here in Washington. She's been a speaker at the National Breast Cancer Coalition event this spring, and she welcomed hundreds of breast cancer survivors and their families and supporters to the Vice President's home at the Naval Observatory to kick off the global race for the cure. So it's really my pleasure to welcome Dr. Jill Biden.
Thank you, Tina, for that kind introduction. Good afternoon, everyone. And on behalf of the President and the First Lady, my husband, Joe, and myself, it's a pleasure to welcome you to the White House. It's an incredible honor to be here today with so many breast cancer survivors. Each of you has used your own personal battle with this disease to raise awareness and to improve access to treatment and education for thousands of other women. As you know, October is Breast Cancer Awareness Month, and hopefully a time for all of us to reaffirm our commitment to the ongoing work of prevention, detection, and treatment of this disease. All of us are here today because the battle against breast cancer is personal. Far too many of us have lost a loved one to this disease or seen a colleague or a friend endure painful treatments in a long battle against breast cancer. I know I am here today for friends whom I have lost, but I am also here for my daughter, my daughters-in-law, my sisters, my nieces, and my granddaughters, and so many women I love. I am here for a future free of breast cancer. My personal involvement started in 1993, as Tina said, when 4 of my close friends were diagnosed with breast cancer. I made a promise then to use my training as an educator to start a dialogue with young women about breast cancer education and early detection. Since that time, the Biden Breast Health Initiative has educated more than 10,000 young women. I started the thank you. I started the Biden Breast Health Initiative because I was touched personally by breast cancer, and I wanted to teach young women that screening and early detection can save lives. Michelle and I hope that each of you here will encourage every woman you know and love to do what they can to prevent, detect, and treat breast cancer. This administration is working hard to ensure that our healthcare system will increase access to preventative care like mammograms. It seems so obvious that focusing on prevention, detection, and early treatment makes much more sense than trying to play catch-up with a potentially deadly disease. We are fortunate enough today to have 3 women who have come to share their stories with us. Stories that can illustrate better than any speeches why we need health reform. Vernell Branch is here from Virginia. She survived breast cancer 7 years ago, only to be denied health care coverage for 3 years because of the cancer. During that time, Vernell was forced to pay out of pocket for her own medical care and did whatever she could to avoid emergency rooms and clinic visits. Johnny Lonesdale is here from Illinois. Like Vernell, Joni is a breast cancer survivor who has also struggled to find affordable, quality health care. The problem is that as a result of her history of cancer, she and her family spend $1,000 a month on health insurance premiums and other medical expenses, despite the fact that her particular cancer presents a low risk for reoccurrence. Venus Ginnis is here today from Texas. Venus discovered that she had a lump in her breast in 1992. She lost her health care coverage when her employer was sold to another company, and since that time, she has struggled to obtain affordable health care. While she battled this disease, she founded a nonprofit organization called Latina Health and Wellness to provide free health education and screening services to those who could not otherwise afford them. I want to thank you all, Vernell, Johnny, and Venus, for coming today and for sharing your personal stories. We know how hard and courageously each of you has fought to beat cancer. Having to battle for health care coverage on top of that is simply wrong. Each of us here today must do what we can to ensure that you and millions of women and families like you have access to quality, affordable, comprehensive health insurance. You deserve no less. So Venus, do you want to come up and tell your story?
Thank you. Muy buenos días. Wait, got somebody else is here. It is truly an honor and a privilege to be here to tell you my story. Thank you, First Lady Obama and Dr. Biden, for your gracious invitation. As a Latina breast cancer survivor and advocate, I made it my mission to provide Latinas with culturally specific health education to increase screening and reduce mortality for breast and cervical cancer, not only in the United States, but globally. In 1992, a lump in my breast was found as I was being treated for an on-the-job accident as a flight attendant for TWA. I had a mammogram, then a biopsy, then subsequently the bad news. Just after 9/11, I, along with many of my fellow furloughed employees, was suddenly without a job and without health insurance. After exhausting COBRA, I sought and was denied health insurance because of my previous bout with cancer. Many of you in the audience can relate to the feeling of abandonment by your employer, by your insurance company, and by your government. I say government because there are no laws to protect us from this type of discrimination. My experiences with our broken health system and my sister's untimely death with cervical cancer due to HPV prompted me to action. In 1997, I founded Día de la Mujer Latina, which translates to Day of the Latin American Woman, a non-profit health and wellness organization. Día de la Mujer Latina health fiestas provide culturally and linguistically specific health education and screening, follow-up care, and patient navigation to poor, underserved, and uninsured Latinas. Under our nonprofit, I was able to get health insurance, but it was pricey and limited. There was no protection for recurrence. According to the Patient Advocate Foundation, as many more Americans lose their medical insurance because of unemployment or pre-existing conditions, they are unable to access life-saving basic care and follow-up treatment. For many of our attendees, this is their only way to get a breast cancer screening and preventative care is at Día de la Mujer. PAF documented a 146% increase of cases from the previous year of patients who were negatively affected by pre-existing medical condition and did not meet the insurance underwriting criteria as a result of this. Today, together with our partners, which include local merchants and community-based organizations, hospitals, researchers and clinics, as well as countless of dedicated volunteers, Día de la Mujer Latina Health Fiestas have been celebrated in over 30 cities across the United States and in Puerto Rico, with a successful outreach rate of 55,000 women over the last 12 years, from all races, ethnicities. We've empowered promotoras, our community health workers, to provide health outreach and support to the many people and the families in these neighborhoods. And these folks are breaking the barriers of medical mistrust and identifying resources for care and support. With my upcoming 17 years of breast cancer survivorship and a very, very busy schedule for 2010, my resolve is to save lives of our medically uninsured and underinsured vulnerable populations, one city, one community at a time. Gracias.
Good afternoon. Thank you, Mrs. Obama and Dr. Biden, for allowing us to share our stories with you today. My name is Johnny Lounsdale, and I'm from Rockford, Illinois. When I first received my breast cancer diagnosis in the summer of 2002, I never could have imagined that it was the beginning of a journey that would bring me to the White House to share my story with you today. I'm happy to say that because of early detection, my health story has been one of victory rather than tragedy. But despite my good health today, my diagnosis has left a target on my back and has made getting insurance a very costly proposition. At 39 years old, I was a healthy mother of 7-year-old and 1-year-old daughters. I was a self-employed graphic artist with private health insurance that I had purchased on the individual market. Because I was young and I had no history of cancer in my family, I thought I was safe from that dreaded diagnosis. But I have since learned that there are many cancer patients who come from families with no history of the disease. In other words, it can strike anyone, even you. At first, I was sure I had received a death sentence. Eventually, I learned that because we caught it early, I had only one very small tumor, smaller than the size of a pea. I received a lumpectomy, followed by chemotherapy, radiation, and 5 years of hormone therapy. At the end of that course of treatment, my oncologist assured me that according to his computer projections and based on my situation, I have a more than 94% chance of remaining cancer-free. Very similar, thank you. Very similar to a woman who's never had breast cancer. In 2005, with 2.5 years of survivorship behind me and a clean bill of health, I got a letter from my insurer saying that my premiums were going to just about triple. I sat and cried. There was no way I could afford it. So I went looking for another option. I was able to get on Illinois' high-risk pool, the state's so-called safety net, the I-CHIP program. But my monthly premiums kept increasing. I now pay $600 a month for a plan that covers me alone. I've looked for other options on the individual market, calling the American Cancer Society's Health Insurance Assistance Service to see if they knew of insurers who would cover previous cancer patients. Even though I'm a survivor and I wasn't in active treatment, I learned that because I had, past tense, cancer, I'm deemed uninsurable in the private market. I will most likely be cancer-free for the rest of my life, but having the word cancer written on my medical chart is enough to generate an automatic rejection from insurance coverage. Thank you for inviting me here today to allow me to share my story, and thank you for raising awareness of this important issue. I will continue to share my story thanks to the American Cancer Society as we advocate together for comprehensive health reform that is adequate and affordable for all Americans and does not discriminate based on health status or history. Thank you very much.
Thank you, First Lady Obama and Dr. Biden, for this opportunity to share my story. My name is Vernell Branch, and I'm proud to say that I am a 14-year breast cancer survivor. I was diagnosed in 1995 and was fortunate to have good health insurance coverage through my husband's employer. That same year, I underwent a mastectomy and began tamoxifen. Shortly after my treatment, I began my work as an advocate for the National Breast Cancer Coalition and healthcare reform. Since 1995, I have been without a reoccurrence of the disease. That sounds like a pretty good story. A story that the best outcome you could hope for and hear when learning a family member or a friend is faced with breast cancer. Well, as in most aspects of life, it was not that simple. In the year 2000, after 5 years without a reoccurrence of breast cancer, my husband Calvin lost his job and in turn, health insurance coverage for our family. He decided to open his own consulting business and elected to continue health coverage through COBRA. We remained covered for about 18 months, the maximum time allowed for this type of insurance. Calvin and I began shopping around for a new insurance plan. Once we found one that seemed a good fit, we applied. Calvin then and my only son of 3 that was still at home were approved in a very timely manner. But coverage for me, on the other hand, was not approved immediately. So I was asked then to submit my health records. And I supplied the information, did not hear back for about 2 months. I tried to find out what the holdup was, but did not get a straight answer. A total of 4 months went by until I found out definitively I was denied insurance. When they asked the insurance company representative point blank if I was denied coverage due to my breast cancer diagnosis 5 years before, I was met with a heavy silence. The best they could offer me was a recommendation to find an employer who would offer me health coverage. I lived without insurance for 3 years. During that time, I broke my foot twice and had to visit the emergency room each time. Anytime I had a cold or needed treatment for a common ailment, I had to visit a walk-in clinic. All of these expenses had to be paid for out of pocket. At one point, while uninsured, I had a screening mammogram. The technician found a suspicious mass and recommended a biopsy to be sure that the cancer had not returned. The mass, thankfully, turned out to be just scar tissue, but the fact remained I had to pay full price out of pocket for this costly screening and surgery, which turned out to be a false alarm. After 3 years without coverage, my family and I moved from California to Virginia. We wanted to start over and look for new opportunities near where my husband and I both grew up and had family support. Calvin and I were able to find work and health coverage through his employer. But for 3 years, I never knew if there would be a reoccurrence and I would not be able to afford the care I needed. I lived in fear that if cancer returned, I would not have insurance to help pay for treatment to enable me to live a full life. Today, as a field coordinator and team leader and advocate for the National Breast Cancer Coalition, I will continue to push for their top priority and mine, access to quality health care for all. Thank you.
Thank you for sharing your stories with us. You're an inspiration for the work we have ahead of us to ensure that all Americans have access to preventative care and quality health care insurance. And we could not have a better advocate or leader on this issue than our First Lady, Michelle Obama. It is my pleasure to welcome a woman who can speak most powerfully from her own experience as a mother, a daughter, a lawyer, and a medical center administration. Please welcome my dear friend, our First Lady, Michelle Obama.
Thank you. Good afternoon, everyone, and welcome. I am so thrilled you could join us today as we mark National Breast Cancer Awareness Month right here at the White House. And I want to thank Jill so much for that kind introduction as well as her phenomenal work that she's done to educate young women about this disease. I think Jill is one of those examples of how one passionate advocate can really make a difference. And we are grateful to you for your leadership and the successes that you've had in your work. And most of all, I am grateful to you for your friendship, as always. I also want to thank Tina Chen, who many of you already know for her outstanding work as Director of the Office of Public Engagement. Tina, thank you so much. And I want to take a moment, yes, let's get Tina over. I don't want to step on your applause, Tina. And I also want to take a moment to recognize all of the survivors and the advocates who are here today who have worked so hard and for so long to raise money and raise awareness to fight this disease. Particularly Vernell, Johnny, and Venus for having the courage to share their stories with us today. I mean, it's hard getting up and speaking about good news, right? Let alone to talk about something that is so personal to a crowd of strangers and a whole lot of cameras. But it's important for them and for us to remind them that it's sharing these stories that really makes a difference. It takes the veil off of this disease, because it wasn't that long ago that people thought that breast cancer was something to be ashamed of and to keep it a secret, something that you didn't discuss in polite company. Some people even wondered, if you can believe it or not, whether breast cancer was contagious. And at the first fundraising lunch hosted by the Komen Foundation, the description of the event was written in one paper as a women's cancer event because the word breast was considered too risque to print. But then people like you, all of you here, started speaking out, including two of my predecessors, First Ladies Betty Ford and Nancy Reagan. They began speaking out. Survivors and those who loved them started organizing and advocating and lobbying for more money, for more research, and better treatment for this disease. And then folks like Venus and Jill started working to educate and empower people to promote early detection and make sure that people were getting the care that they needed. And today, because of that work, the number of women getting regular mammograms has dramatically increased, and the 5-year survival rate when breast cancer is diagnosed in time is 98%, and that's compared to 74% in the early 80s. And today, we spend $900 million on breast cancer research, which is 30 times more than what we spent in 1982. So we have come a long way. And you should all be proud of what you've achieved to get us this far. But what we all know is that we are not finished yet. We are not finished yet. We know we're not finished when nearly 1 in 8 women is still diagnosed with breast cancer in their lifetime, a total of 1 woman every 3 minutes. And nearly 2,000 men are diagnosed each year as well, and that's something we don't often discuss. And we know we're not finished when 40,000 women a year still die from this disease. That's 1 woman every 13 minutes who's dying from this disease today. And we know we're not finished, especially not when we have a healthcare system in this country that simply is not working for too many people with breast cancer and too many people who are surviving with breast cancer. It's a system that only adds to the fear and stress that already comes with the disease. And I'm not just talking about women without insurance who face the terrifying prospect, as you've heard, of having to pay the full cost of their treatment on their own. I am talking about people in this country who have insurance, who have breast cancer. Folks who all too often find themselves also paying outrageous out-of-pocket costs. According to a new report released by the Department of Health and Human Services today, breast cancer patients with employer-sponsored insurance paid an average of more than $6,200 in out-of-pocket cost over the course of a year. And some wound up paying as much as $10,000 or $20,000. And 5% with private insurance paid more than $30,000 a year for their treatment. This is with insurance. These are people who are blessed. And then there are those annual lifetime caps that insurance companies set, where once you go over that cap, as many women do because some forms of breast cancer are so expensive to treat, then that cap makes it impossible to pay a penny more for that treatment. And one recent survey showed that 10% of all cancer patients report hitting a cap on their benefits, leaving them scrambling to find alternative insurance to figure out how to pay out of pocket for the rest of their lifetime. And then there's what happens when you've gone through all the treatment and you're finally in remission, which should be good news. You're finally in remission and you're finally feeling like yourself again. You feel whole and happy. But then, as you've heard, you're stuck, as Johnny said, with a target on your back for the rest of your life with a pre-existing condition, which means that insurance companies can deny you coverage or charge you higher rates for coverage, sometimes much higher. That's exactly what happened to Vernell, to Johnny, and to Venus. These women were denied insurance, and now Johnny and Venus are each paying very high premiums for their coverage. And as you've heard, Venus's insurance won't even cover treatment if she has a reoccurrence. So I know that a lot of survivors like them are terrified. They are living in fear of losing their jobs or changing jobs or even moving because they're worried they won't be able to find affordable insurance. And perhaps most heartbreaking of all is the fact that right now, today in America, there are people in this country who have breast cancer, but don't even know it because they can't afford a mammogram. According to our new report, 1 in 5 women aged 50 and above haven't gotten a mammogram in the past 2 years. And while that's better than it was a few decades ago, it's nowhere near good enough. And this is not acceptable. This is not acceptable in this country. This is something that could happen to any of us. And this is a disease, as we know, that affects not just those diagnosed with it, and not just those who've survived it and those who've lost their lives to it, but it is a disease that also affects those who love and know them, which these days seems like almost every single person in this country. That's why it is so critically important that we finally reform our healthcare system that is causing so much heartache for so many people affected by this disease. Now is the time. Fortunately, that's exactly what the plans being considered by Congress right now would do. So just to be clear, under these plans, if you already have insurance that works for you, then you're all set. You can keep your insurance and you can keep your doctors. The plans put in place some basic rules of the road to protect you from abuses and unfair practices by insurance companies. That would mean no more denying coverage to people like women we heard from today because of so-called pre-existing conditions like having survived cancer. Because there's a belief that if you've already fought cancer, you shouldn't have to also fight with insurance companies to get the coverage that you need at a price that you can afford. These plans mean insurance companies will no longer be allowed to cap the amount of coverage that you can get and will limit how much insurance companies can charge you for out-of-pocket expenses. Because in this country, getting sick shouldn't mean going bankrupt. And finally, these plans will require insurance companies to cover basic preventative care, from routine checkups to mammograms to pap smears at no extra charge to you. And though I want to emphasize that in the end, as we all know, it's our responsibility as women to also talk to our doctors about what screenings that we need and then make the appointments to get those screenings, even when it's inconvenient or maybe a little bit uncomfortable. It's something that we owe not just to ourselves, but to the people that love us, because we know the difference that early detection makes. We know that if breast cancer is detected early, it's far easier to cure and much less costly to treat. So we can save money, we can save lives, and we can do right by the people that we love. So that's how health insurance reform will work. That's how it will help people who have been diagnosed with breast cancer and those who've survived the disease. But first, we have to get it passed. First, we have to get it passed. But that's the hard part. We know that there are all sorts of myths and misconceptions out there. And we know there are folks who will do anything they can to stop reform because for whatever reason, they want to keep things the way they are. From where we stand now, it might seem like an uphill battle. But fortunately, folks like you know a little something about an uphill battle, right? You know a thing or two about overcoming long odds and rallying people to an important cause. Now let's remember that there was a time when those affected by breast cancer never could have imagined all these pink ribbons that will one day grace the White House, offices, storefronts, lapels. I don't think they could have imagined some hulking NFL player decked out in pink cleats and pink gloves. I don't think they could have imagined a day where so many people would wear jeans to raise money for a cure. I don't think they could have imagined how many people would lace up their shoes to take part in walks and runs and races all across America. And it is my hope that if we pass health insurance reform, then 20 or 30 years from now, just imagine, our daughters and our granddaughters won't be able to imagine a time when any woman in this country couldn't get a mammogram because she couldn't afford it. I hope that our children and grandchildren won't be able to imagine a time when anyone in this country went bankrupt just because they had the misfortune of getting sick. And I hope that statistics like 1 in 8 and 1 every 13 minutes will be incomprehensible to our kids. Incomprehensible. Because of all the strides that we've made and the work that we've done for this cure and for this reform. And in the end, that's really what health insurance reform is all about. It's not about us. It's about them. It's about the future. That is what we're fighting for. That's what we have to remember. That's what this fight is about. And that's why we're so grateful to all of you for the hard work and commitment and sacrifices that you've made. And we look forward to working with all of you in the weeks and months ahead. Thank you so much. Thank you.